one of the things we wanted to do is try to go through the different ways agents can work with our system. You know, the first one we're going to do is we've already logged into the system. The agent would have their own ID, their own password, and the last 4 digits of their social security number. And that's the requirement to get access to the system. Each agent would have their own access. And then if we had a group of agents, we could create subgroups with that where we can create some hierarchy in different organizations. So the first one is the easier one, which is that an agent would just send a lead to LifeQuotes for, you know, because they don't want to handle it. So I'm going to have Nathan show you how to do that.
Thank you. Yeah, this is actually pretty simple. This is just a matter of putting the name and address and a telephone number and the date of birth, best time to call them, things like that. It's pretty easy to do. And that actually will pre-populate the city and state. Email address is optional, but it would be very helpful for everybody involved because one of our agents basically would be contacting them. You can also put in comments. These notes actually show up for an agent to actually give them a call if you want to elect to go this route and say, please call after like 5 p.m. And so that will, you just hit the transmit lead to LifeQuotes, and that will automatically go to LifeQuotes from there, where an agent will actually pick up and actually call on that person, and it'll say successfully routed to that. Now, that will still show up in your lead history, just the same way that Rob was talking about with the different hierarchies. So that's your personal lead history. And also, if you have either an agency underneath you or as a bigger agency, you can actually see multiple people underneath you and the people that they've sent or they've written or are writing right now on there as well by just clicking on the agency lead history. So that gives you kind of a larger scope of that and your personal lead history of people that you've actually put in there yourself. And so here's the John Smith. I'll just go ahead and pull him up. The person who actually writes this, you can actually use this to quote that person as well and use our quote system. Our quote system is very unique in the fact that it can actually quote based upon the person's birth date, their sex, their height, weight, and coverage amounts. Those are the first factors as far as the life insurance goes. And so their bill, it's very, very accurate. So if you put somebody in at 205 pounds, our search engine actually quotes the best available for actually somebody who has 205 pounds. If they're a pound over, that actually can affect the rate. That's just another way that it affects how you quote in the system. And our agents here use this where we actually compare the rates of 35 companies and they can send out quotes, and we actually send out and we actually create an option for you to create customized comparison quotes with the best options for your customer, price comparison quotes, and also individualized quotes as well. And so that is something that we offer for you guys, and it has your name, your contact, your email address on there as well. And this is an interesting question here regarding tobacco or nicotine. We have various options that go through the different carriers that you guys offer and see which one basically comes back with the best offer, from the occasional cigar user to the person who uses e-cigarettes or the person who uses just snuff. And it will find the best company based upon that information. And that's really the design of the whole platform, is like private piloting. Our system codes and changes our options of who is the best company based upon being a private pilot if you answer yes to that. And also the driving and DUI history as well. This gives the best case scenario of, say, somebody who has a suspension or revocation in the past or had a history of DUI. Now, it certainly doesn't cover all of those comprehensively, but we do have a free form here that you can provide more details, which is actually very useful in just kind of collecting that information just to determine what is the best factor that affects the life insurance rates. And bankruptcy is another one of those things that the life insurance companies do look at, And so by clicking on yes for having a current active bankruptcy that's not been discharged, that also affects the rates as well. And that's basically how the quote engine works. You answer yes, that will filter out the companies and find the best based upon the answers you put in there. The same way it goes for like travel. That's a big hot button right now with countries that are currently on the do not travel list right now. And we find the best company based upon the do not travel list, and also a free form to enter in the other history, such as scuba diving, other major crazy sports that people may or may not do, mountain climbing and things like that. And we can actually use that to create a more accurate quote for the person. This is basically the same way with blood pressure. You can compare the rates for people with blood pressure, family history. It's a sore subject, but heart disease and stroke and cancer does affect the rates. And so our quote engine actually goes through and says, hey, I had a dad who died before the age of 60. What is the best company for me? That's basically what this is doing for you. And the same way with the major health conditions as well. These are probably the most of what people have, not saying everything that they have, but you have anywhere between alcohol abuse to vascular disease in this list. And each one of these will affect the rates, and it will show you exactly which companies have the best option for you. Now, I don't want to jump over this, but I also want to highlight a couple of things really quick here regarding if a customer has ever been rated up or declined. Just a question that we as LifeQuotes ask to make sure that if somebody's ever had a rate up, it's typically because of one of these health conditions up here, and also maybe some of these questions up here, answering those not in the exact form when you're talking to somebody over the phone. And we also ask how many doctors they've seen, because that also can be a good identifier if they've seen a specialist for their skin because they've had skin cancer, things like that, that can actually affect the rates for life insurance. And we ask this question basically because the recommendation of a doctor that they've had a procedure is a showstopper for a lot of life insurance companies. They'll basically say, we want that result to come back before we actually are underwriting you, and so we want to make sure they've completed their tests and procedures. And so down here, again, these are the questionnaires. The nice thing about this is that, yes, you click on this anxiety questionnaire and it will filter through the companies to find the best one, but this also has a field underwriting guide questionnaire, which actually gives you an idea of like how severe the anxiety, ADD, ADHD, depression, or mental illness actually is. And that actually is just an indicator of, say, if somebody has mild anxiety to more severe depression, have they been hospitalized? Questions like this that all the underwriters would want to know. It's just key information that we use to gather to get a good idea and a glimpse into what the health history is. So it kind of takes the information that what an underwriter or life insurance companies want to know, and we use it to basically filter and factor in to what would be the best option for the client based upon the information that we've provided. And so then again, if there's any other health conditions that we haven't discussed, this is sometimes where somebody has another health condition that's outside of these that maybe is a little bit, not as often you'll find as some of these in this health history questionnaire. It will cause them to answer yes to that and say, yeah, I have a history of Meniere's disease or something like that. And we use this also because we do have policies that if you purchased a term policy in the last 60 months, that they're eligible to get a policy at a no-exam option for them. Thank you. And so if I click on blood pressure and I click on I don't know to both of those, that assumes that the person actually is in good health. And like the cholesterol as well, they're having good cholesterol numbers as well. That's actually what I don't know means. You can also select the actual blood pressure numbers if the person knows them, and that would actually factor into the rates. And there's some questions for like somebody who's on medication for those as well.